I just want to acknowledge that Senator Warren said food tank at least twice. It gives me great joy. I want to welcome our panelists again. Thank you all for being here. This is going to be a great conversation. So Ashley, I get to sit at meetings with you quite a bit, I feel like, over the years. You always have great shoes on. But I want to start with you because I want to talk about the barriers to scaling produce prescription boxes. Why are there so many barriers to something that's so common sense to someone like me?
Yeah, thank you so much for having me, and that's a great question, and we have limited time today, and it's a really in-depth question, but I guess the best way for me to really sum it up is there's so many policy constraints right now. I think it also goes to many of our government agencies don't speak, right?
Right.
USDA does not speak with CMS, Center for Medicare, Medicaid, and there truly isn't a line item budget right now within healthcare for food outside of MLTSS population, which is like very, very chronically ill population that get, medically tailored meals delivered or meals post-discharge when you come out of the hospital. So when I started off in healthcare with FarmboxRx, we had to figure out how can we have this make sense, produce prescription, if you will, to a CFO of a health plan that knows that there isn't a budget within healthcare right now for food or produce prescriptions. And the way we've done that is by using the box of food as a tool to engage members in Medicare and Medicaid in doing other things that the government does pay the health plan to have done. Things like getting your mammogram, getting your flu shot, getting your diabetic eye exam. So truly, it was really revolutionary what my team did to get food as a line item budget without there being a budget. But we still have so much work to do. But we like to say at FarmboxRx, we don't need to hold the entire market. We just need to have a seat at the table that's going to allow other innovators to come in to help solve this massive problem we face.
Absolutely. That seat at the table is so vital for breaking down the silos that you first started talking about. So Mike, I want to turn to you, and obviously we have so many lessons that we are learning from the COVID-19 pandemic. I'm afraid that we're going to forget some of them, but we learned that, the role of pharmacies is so important. And I'm wondering how we can position pharmacies to treat not only symptoms, but address these sort of problems, be preventative, address problems before they become problems.
Yeah, I think, we tend to have a pretty short recollection on things. There were a couple of things we learned from COVID, and being involved at both the federal and the state level and the rollout of that, one of the things that we learned from that is that the capabilities and capacity have to be there.
Yeah.
It was a really important issue that needed to be resolved. The people needed to mobilize around the uncertainty of that in a pretty unprecedented manner. Pharmacy, I think, has the infrastructure to address issues like that. I just think historically we look at the end of this and we're treating the symptoms of something. And I think that's a lens that is beginning to change as shareholders. And this meeting is really demonstrative of that. You look across what's here today, and I have to applaud all of you. There is a growing acknowledgement that we need to address the systemic issues that are driving a lot of these unfavorable results, which are driving up the unsustainable costs of healthcare here in the country. And so I think pharmacy could really play an important role in that, not just to treat the symptoms, but really begin to look at what people put in their bodies that are contributing to some of these health outcomes that are just not sustainable and compromising quality of life, particularly in underserved communities. And we see that a lot. We're a premier HIV provider in a lot of the underserved communities. And so we think there's a prominent role here for pharmacy to play and partner up with a lot of the nutritional companies to really address this problem in a really humane and honest way.
There's so much opportunity. I'm glad you mentioned humane. There's a way to do this in a way that really is human-centered and puts people's voices at the center of this. So Taryn, I'm wondering from you, since this is a panel focused on the private sector, and you're all sort of leading in this space, is too much emphasis being placed on the private sector or not enough?
I definitely think there could be more partnership. In terms of, I come from the dietary supplement industry. I've been there for 20 years. And we continue to look for ways to educate consumers on how well-researched ingredients, herbal medicine, other nutrients can have a significant impact on people's well-being, health and well-being. And the research, I think that the USDA, the NIH is doing great work to kind of look at a number of dietary components, but when you think about it, they're focused on maybe 150 or so dietary components, and in reality, when you consider that we're taking in like over 26,000 compounds from the diet, there's an opportunity to really understand on a much deeper level how other compounds, phytochemicals, phenolic compounds within the diet can have a significant impact. And that kind of research then, I think through partnership with the private sector can actually help inform consumers how they can have a more meaningful impact in their own diet. Yeah.
Thank you so much, Taryn. So Ashley, I want to go back to you, and I want to talk about the progress the private sector is making in this space around incorporating food as medicine as a concept into things that they do, but without the greenwashing isn't the right word here, but sort of health washing, without health washing it, with making it true and believable and important for consumers.
Well, I think if we take a look at, how much we've grown in the space over the last 3 years, right? So in 2020, the Center for Medicare and Medicaid allowed produce to be offered as a benefit to members in Medicare and Medicaid. And that was revolutionary in itself, right? They said, we're going to take a look at the whole person and what is making these individuals sick. And we've went from, in 2020, we had one single health plan that I had to beg and offered a kidney and to name my next child after them if they would allow me to give produce to their membership. And we now have 87 plans we work with. We're with 4 of the top 5 largest health insurers in the country. And so I think that speaks volumes as to where this is going to. If we even look outside of food, now the government is allowing things like pest control to be offered even as a benefit of what is that doing if pests are eating food in these members' home? So taking a look outside of, let's just treat with pharmacy, right? Let's just treat with medication. If you're type 2 diabetic, that's just what it is. Let's start to reverse this. And so I do believe that where we're headed with the 1115 waivers that are coming out in Medicaid that gives you the option to offer food as well, I think in the next 3 to 5 years, I think that we're going to get there, that there's going to be that budget within healthcare that a plan has to offer food to those who have chronic related disease caused by food.
3 to 5 years, that's not long at all. I love it. It's so hopeful. So you mentioned this whole person approach. And so Mike and Taryn, I'm wondering, both of your companies need to look at the whole person. It can't just be sort of these, particular elements. How do you do that effectively? Taryn, do you want to go first?
How do you look at the whole person? Well, holistically, mind, body, spirit, right? So you have people coming in and you want to consider, what is their mental health, right? And we know that actually food can have a big impact on our mental health. And right now there's no better time than right now to think about that. And we know that higher quality diets are associated with lower depressive symptoms. And so I think just that idea of the educating again around how food can actually work on that kind of whole level, that mental level, and getting people really engaged and excited about what they can kind of proactively do. When they start to experience the benefits, kind of those tangible benefits of feeling better, having more energy, it becomes this kind of virtuous cycle where they want to continue to do that stuff. So we have to encourage them to make those changes, have those experiences, and then they start to share out with more people. And I think actually, Mike and I were talking earlier about, how even pharmacists and other healthcare practitioners can play a really big role in inspiring that kind of change. So I'm really on board, and actually I've been doing a lot of work over my career to help inspire people, the practitioners, the people that are kind of on the front lines. And sometimes that's even, it's not necessarily in the healthcare practitioner's office. You need these other, channels by which people can get that information.
Absolutely.
Yeah.
So, Mike, I pick up my mom's prescriptions for her. She's sort of housebound now. And pharmacies and pharmacists have become very important in my life since the COVID-19 pandemic because they give me a lot of information. They also cheer me up. They look at the whole person because they understand that my husband and I are sort of my mom's caregivers. Are we asking too much of pharmacists to look at the whole person? Because, it's a lot to put on these professionals.
I think the short answer to that is no. Pharmacies and pharmacists play an important role in the communities that they're located, right? You're 10 times more likely to go see a pharmacist than you are your doctor. In many instances, the people that run and operate the pharmacies are your neighbors. They're the people that stand on the sidelines with you. They're people that are intimate in terms of helping you move to point B in your health, assuming
Sure.
point B is some more favorable place. So no, I don't think it is too much to ask. I think those people are appropriately positioned to take on a broader set of responsibilities and taking a step back in terms of how we've traditionally treated our patients. You can see where all of this is moving. The idea that we're going to look at people holistically is exactly the right approach. We're going to move to a system where people are rewarded on the outcomes in terms of compliance and adherence, and living longer and healthier lives. I go back to what I said before. 90% of Americans live within 5 miles of a pharmacy. Half of those people live within 1 mile of a pharmacy. So from my perspective, when you look at the screening, you look at the testing, you look at all those things that are residing in these community high-touch care providers, they're sitting there as an underutilized resource to really pick up the mantle for food as medicine.
Sure.
And the time is now. The time is now.
Yeah.
You can feel that. How many people are in this room? How many people have coalesced around the idea that we can no longer continue to treat the results of a problem? That makes no sense. We have to go back to the beginning of this and address the fundamental issue. There is no good place to stand after the problem has already happened.
Sure.
And that's what this is about. And as a representative of the 40,000 pharmacies across our country, I'm here to let you know we're prepared. We're ready. We're ready. We think it's an integral time to put our money where our mouth is here and be the care providers that we know we can be.
We've given a lot of, exactly. We've given a lot of applause to dietitians and nutritionists and other medical professionals today, but I want to give a shout out to pharmacists who are really on the front lines of so many things that we're dealing with right now. And so, Mike, I do want to continue with you. I want to know what you envision. What's your vision for the future of partnerships between pharmacies and grocery stores and how they dispense food as medicine?
Yeah, so I look at this is about collaboration and collaborating in good faith with other shareholders that are objective in their desire to move forward and organizing new kinds of chaos in the service of their customers. When you look at the 40,000 pharmacies that are scattered across the country, many of them are grocery stores. I think Senator Warren said it best. These should be subsidized prescriptions, just like a regular prescription, and they should be our first go-to as we're looking at really addressing the foundational issue for what has become diabetes, a diabetes issue, cardiovascular. Just look at the facts, look at the dollars. They're unsustainable by every standard. We have to do this. We're morally obligated to do it.
Yeah, absolutely. Ashley, do you have that moral obligation? I know you do.
Oh my gosh, we take so serious here at FarmboxRx this movement. We were the first ones to break into healthcare, and we knew that, the pressure was on, right? Like, they're just looking for something to, crack a hole in what we're doing. And so the data that we give back, to CMMI, which is the innovation hub for the Center for Medicare and Medicaid, the data we're giving back to the health plans, it goes around what she was talking about of engagement. That's everything to us because it's the ridiculously obvious notion that if you eat healthy, you're going to be healthier. And it's a very common misconception that just because somebody is low income, they don't want to eat healthy, they don't have accessibility, affordability, and they don't understand what to do with what is put in front of them. That's not from a bodega, that's not unhealthy. So that engagement piece of how we get members to engage with this box in other preventative health measures that the plan can wrap their head around, that they need these members to go do, that is what's led the door open,
Right.
that we believe is going to be to the ultimate produce prescription.
Yeah, and it's breaking those stereotypes, which is so, so important when we're talking about all of this. Since we're sort of at a key part of the afternoon, I want to make sure that you all get a chance to talk about two things. And if you can say them quickly, you can talk about both. What pisses you off? Because I think that we all have challenges. And then lastly, what inspires you? So Taryn, what pisses you off?
Off is, well, I do think that, again, we don't have access to enough of diversity, I would say, of the foods that really can be powerful medicine. We really don't provide those fresh access points, and then people really aren't aware that there's other ways to kind of supplement their diet with nutrients and with phytochemicals. And I think herbal medicine is one way that you can really expose people to more phytochemicals within their diet. So I want people to know that yes, food, but also there's a lot of other plant helpers in the world that can help people on their journey. And what inspires me is that people are actually turning towards food, and they're turning towards plants. And as they are looking for answers in their life outside of just the pharmaceutical approach, that they're realizing that they're coming back to kind of this innate understanding that what you put in your body actually does have this major impact on your quality of life. And the research is also validating that. I mean, you look at the research on botanicals, and it has been exploding over the last couple decades. So I think we are starting to understand more just exactly how powerful food and plants as medicine can be.
Diversity is certainly key. Mike, what pisses you off quickly, like 10 seconds?
Willful blindness drives me crazy. Pretending that a problem doesn't exist makes it infinitely worse. I hate that. What inspires me is when people come together in the service of something bigger than themselves to liberate people to be the people that they're obligated to be. We're doing that through a Food is Medicine initiative, and when we do that, the people that benefit from that inspire the people around them to be better versions of themselves, and then everything isn't kind of better, it's way better.
Love it. Ashley, what pisses you off?
A lot of things, but the red tape, and really that common misconception that just because people are low income or live in a rural area, they're in a food desert, that they don't want to eat healthy.
Right.
That really drives me to my core. And what really inspires me is everybody out here, because I know 3 years ago when I started off in healthcare, they looked at me like I had four heads. Like, you want to deliver produce to who? My members? So the fact that the movement has grown so much in just the last few years, that's what inspires me.
The movement has really grown. That's thanks to so many people in this room. That's thanks to the people on stage. Please give them a round of applause. Thank you.